I'm Rosnita binti Ismail. I've been working here in SGH and National Art Centre since 1997 for the past 19 years. On the first day, I was really very proud of wearing the green uniform, which was under SGH back then. But the feeling of uncertainty, thinking whether am I equipped enough to be nursing the patients in the medical ward, it's always been in my mind. But once you start working, getting the guidance from the seniors, actually slowly I tend to think that this is my call. Honestly speaking, the main reason why I'm still in nursing is actually the colleagues that is around me. You can see that this is my second home. I saw this particular patient that had been hospitalized. So he actually verbalized that he won't be long in this world. He just wants his 9-year-old son to be at the bedside with him, just for a night. Maybe that's a simple request. But I did inform the nursing manager. The next morning when I came back, my night nurse informed me that the patient has no regrets leaving this world as his last request is already granted. No matter how small your role in looking after the patient, it do make a deep impact.
My first day on the job, I was very excited. So actually I was working in a microbiology lab and in the chemistry lab. Even though I really enjoyed the time there with my colleagues, there was something lacking. I started looking into volunteer opportunities, but somehow it was nursing that really captivated my heart. And when I finally put on this uniform, I thought this is the day I'm going to start working as a staff nurse. The first time I put it on, I was really proud that I was finally part of the SGH nursing team. I knew that I like children, and seeing a room full of babies, that was really joyful for me. When I first started off, I would notice that how come seniors, when they swaddle the babies up, the babies would just sleep so peacefully. But when I did it, the next moment the baby would be kicking and coming out of the swaddle. Initially I thought, oh, these babies, they know that I'm new and, and they're just being difficult with me. When we're new, sometimes we lack the skill, but as time goes on, then it becomes natural to you. It was different in the ICU. The babies there tend to be a lot more smaller. They seem so fragile, but actually they are much more resilient than we think they are. Often I would swing by to take a look at the babies that I've taken care of before. It's always a joy to see these babies progress on well. I met the nursing deputy director, and I remember her saying about how a nurse is someone who cares for her patient, who puts her patient's needs first, and who is always careful about what she does for her patient. And I vividly remember her saying about how if I put my heart into becoming a good nurse, then she's also certain that I'll become a good nurse. And that was very encouraging for me to know that someone who is so much more senior than I am still remembers that there's a young nurse starting out and caring about how she's doing.